3 signs of early miscarriage. More than 80% of miscarriages occur in the first trimester, which is why many couples don't share their pregnancy news until they pass the 13th week. However, just for the record, when you announce your pregnancy or share your news is completely up to you, and there's no wrong or right time to do so. So what are the first signs of a miscarriage? Depending on the medical situation, the physical process of losing a pregnancy can vary from person to person, says Jennifer Jolley, MD, Assistant Professor of Maternal-Fetal Medicine at the University of Washington in Seattle. Here, we break down some signs of miscarriage in early pregnancy. Uterine cramps. Cramping with spotting is the #1 sign of an early miscarriage, according to New York-based Zev Williams, MD, Ph.D., Director of the Program for Early and Recurrent Pregnancy Loss, PEARL, at Montefiore Medical Center, Albert Einstein College of Medicine. Miscarriage cramps occur because uterine contractions expel the contents of the uterus. Bleeding. Bleeding during pregnancy is one of the most common miscarriage symptoms, and it should always be brought to the attention of a doctor. We take bleeding very seriously, explains Dr. Joshua Hurwitz, a board-certified OB/GYN and infertility specialist. That being said, it doesn't mean that every time you bleed, you're having a miscarriage. While a lot of bleeding in pregnancy is benign, we bring a lot of women in for reassurance. You should assess your bleeding before calling the doctor, according to Dr. Hurwitz. Ask yourself what kind of bleeding it is, he states. Is it 1 drop of oldish, brown blood, or are you filling up pads with bright red, period-like bleeding? Those are the types of questions we will be asking to help you figure out what's going on. Generally, the heavier the bleeding, the more cause for concern. Similarly, some people will pass discharge, white-pink mucus, tissue, or clot-like material while having a miscarriage. Pain. Pain can be another sign of miscarriage in early pregnancy. This pain may be located in the abdomen, pelvic area, or lower back, and it can range from dull and aching to period-like cramping. It may be difficult to distinguish if the pain is normal, since round ligament pain and even cramps can occur during early pregnancy as your body expands for the growing uterus. Always consult your doctor if you're unsure.